Section 4. Actions for dealing with harassment or bullying. This section includes actions for dealing with harassment or bullying, actions for dealing with workplace violence. Immediate actions. If you are bullied, there is a need to take immediate action to deal with the person or persons that are bullying you. Grimm and Grimm suggests the following actions in order of decreasing effectiveness. Assert yourself verbally by using phrases such as, "I'm not comfortable with what you are saying or doing. Please stop that," or "I don't like that. Thank you, but no." Use the Navy traffic light system, a measure developed by the Navy to assess sexual harassment. A red light means the action is offensive, such as being asked for sexual favors or being touched inappropriately. A yellow light is a caution where the situation is bordering on inappropriate, for example, being questioned about your personal life. A green light indicates that you are comfortable to proceed, such as being asked if you had a good weekend. Expressing your actions non-verbally are demonstrated when you turn or walk away, frown, or shake your head. The least effective method is to say or do nothing. However, in some situations, this may be appropriate if you believe any form of confrontation would escalate matters, in which case it should be reported immediately afterward. Once the immediate action is taken, you should consider how to address the bullying on a longer-term basis. First steps. Talk to other people. It is often helpful to talk informally to friends, family, trusted colleagues, or a workplace counselor. If you have symptoms of stress and anxiety, seek advice from your family physician or nurse practitioner or workplace occupational health department. They can assess your fitness to work or return to work. Many organizations now provide employee assistance programs for staff to access anonymously. This is one way to grasp what is happening to you and clarify that you have a genuine problem. The importance of keeping a written record of incidents cannot be overestimated. It can be therapeutic, help to clarify exactly what is happening so you can do something about it. Remember that a diary of events provides vital evidence for the investigation into your case if you decide to make a complaint at a later time. If you find it difficult to write things down, remember to make your notes short and simple. A pointer to help you is that you should write down the details as soon as possible after the event while they are still fresh in your mind. For nurses, this is a cardinal rule of documentation, so it shouldn't be foreign to you. Record the following details: date of incident, location, time, nature of incident, your response, your immediate feelings at the time of incident, actions taken or not taken, names of witnesses. Options for action. Before you decide what action to take, find out about your workplace policies and procedures. Talk things through with your union or human resources representative or your employee assistance counselor who must treat such conversations confidentially. They can explain what will happen in more detail. Actions for assault. While bullying and harassment occur at times at work, occasionally assault may also take place. The Massachusetts Nurses Association has identified what you should do if you are assaulted at work. To prevent the escalation of incidents, RPNs should learn to recognize and report behavior that is disruptive or could lead to violent events. Employees have the right to expect a work environment that promotes safety from violence, threats, and harassment. They can actively contribute to preventative practices within their organization by doing the following: accept and adhere to an employer's preventative policies and practices. Become aware of and report violent or threatening behavior by coworkers or other warning signs. It is everyone's responsibility to prevent workplace violence. Individual RPNs must take every action possible to help prevent violence of all kinds. You can name the problem, raise the issue, determine process, engage in reflection, be the solution. Ensure you develop self-care and do the things that help you to be healthy and happy in all aspects of your life. Step up. Warning signs of violence. Even though this section lists some behaviors that may indicate a potential for violence, It is important to keep in mind that these characteristics do not necessarily predict violence and that some violent people may display no symptoms at work. Remember to use some common sense when assessing patients, visitors, and colleagues. If unsure about a person's actions, ask yourself to consider these 2 questions. Does this behavior scare me? How do other people whose opinions I respect feel about this? Commonly identified behaviors that may signal the potential for violence. Outbursts of rage and anger, intimidates others, cooperates poorly with others, blame others for own problems, displays changes in work patterns, extreme or bizarre behavior, deep depression, involved with alcohol or drugs, recent loss, fixed on injustice, low self-esteem, history of violence, or acts of sabotage. Options to deal with individuals that have harassed you may include: make a direct approach. Making a direct approach is often effective in dealing with less serious harassment situations. Talk to the person who is bullying or harassing you. Their behavior may be unintentional and would stop if they were aware of the effect. You can make this approach alone or with the help of your union or HR representative or a friend. If you do this, it is important to use a calm and reasoned approach and make a note of everything that is said. You can do this either at the time of the incident or immediately afterwards. Informal. Discuss incident with your manager or supervisor. Ask if you will be named or if this is anonymous, when the meeting will occur, how the outcomes will be communicated, what the plan is if this action is unsuccessful, and what other options are available. Formal. Written complaint is filed in a report. Used when continued abuse occurs or when it is of a serious nature. Follow organizational policies and procedures.